Well, we were talking about pain right before the break, and Ray called in with a very interesting call about, he had two parts to this question. One was about the phantom pain, and the other one was about perception of two different types of pain at the same time. And certainly your body will, as your conscious mind, if somebody grabs or pinches you, you're going to focus on that, and you may not focus so much on the other part of that particular pain. But after this stimulus is over, you may pick up the other one, and that brings up how pain is basically transmitted from the site at which it occurs up to our cortex, where we perceive and react to that particular pain. It also brings up the subject of what happens during a very stressful situation when a lot of adrenaline is coming. You may actually be hurt and never know it. And so a lot of people would call that a shock situation. You're in shock, more or less. Not because you're in shock because you have low blood volume, but because your body, because when you get that fight or flight reaction, you're basically going to increase your blood flow to your core. Your peripheral system blood flow decreases. So you may not actually have the nervous input into your fingers or feet or things of that nature. But after your adrenaline surge goes off and the blood flow returns to that and the injury is perceived or visualized, you actually perceive that pain. And pain somewhat is also a learned response. Take, for instance, the baby who falls, and a lot of them do when they first start walking, and they fall, and they get back. I mean, normally you and I would fall. We would have some feeling or expression of pain. Ooh, that hurts, or winch, or something of that nature. That baby gets right back up. It's only when the mother goes over there and starts to scream, cry, or looks excited or looks startled, that the baby gets excited and gets startled and then starts to cry because he didn't understand what all the commotion was about. And then so the next time they fall, there's a learned response to cry when they fall. And this is how we learn certain things to, how we have learned behavior, and we sometimes don't know why we do certain things in that respect. So I know I digressed a little bit, but that's the higher cortex thinking of pain. So a lot of the newer drugs that were developed actually tried to block pain on multiple levels. And it's kind of like when we treat diabetes. I mean, we may have to give you an agent to help you excrete the sugar from your urine, or we may have to block the insulin, the sugar, slow down the insulin secretion or its effects on you, like metformin, or trick the stomach not to empty or feeling full, like the secretagogue. So sometimes in chronic pain, we have this supratentorial, which I call this up here, this cortex thinking of the pain, and there's sometimes secondary gain from pain, which is a very difficult situation to occur because people are consciously, it really hurts to them, but subconsciously they're getting a secondary gain from their pain, either in attention or caregiving and other things of that nature. So therein lies no reason for them to become out of pain. So this brings in this whole big issue. So yes, and I know that was a long answer to a very short question, and yes, it's true. Sometimes you can block out. You only perceive one type of pain, but I think the subconscious mind is taking in everything and dealing with it on multiple levels. Now, you also talked about phantom pain, and phantom pain again relates to the supratentorial, or this upper process of memory and things of that nature. Take the instance, the baby that falls and doesn't cry but gets startled when the mother runs over there. That is a learned behavior. So why does the baby cry again when the injury was not as significant? Because they learned that. So if you have an injury or chronic pain in your leg, your mind, it remembers that particular pain. It remembers what it does. You feel it even when maybe you don't feel it. And so that is basically what phantom pain is. It's a memory of that particular pain, even though the leg is gone and you're not actually getting any stimulus for the pain. Your mind will still remember the presence of that leg, and out of nowhere you will get that. So that's our memory system working against us in that respect. Can you block phantom pain? Absolutely not, unless you are not conscious It will startle you in that respect. There's also referred pain, pain that's being referred from another point in your body. The reason from that is that the nerves are in our embryologic development. They are pulled from an area and come down there. So your heart pulls from your left side, so therefore you're going to get referred pain to your left shoulder or your back if you've got chest pain. Pain in your ear might come from your throat because the throat is pulled down from the ear. So referred pain is a very common issue in dealing with the story of how things develop, which is what I tell patients too. Listen, I mean, there isn't, when you're listening to a patient and doing your history, the disease process is a story. It's a storyline from beginning to end. It's my job to understand that story, to understand how that works with certain disease processes to put together a potential or preliminary diagnosis and come up with a plan to try and deal with that. So I think we have Chuck on the phone. Chuck?
Yeah, Doc, can you hear me?
I can.
I love the subject tonight, but I got to switch it for a moment. There was another article today in the news was full of Jimmy Carter and his cancer miracle cure, I'll call it. I called you about this a couple months ago, but at any rate, Carter announced in August that he had melanoma that had spread from the liver to the brain. And I think everybody kind of wrote him off that, you know, that's the end of the story. Well, then sometime in December, he said he was cancer-free, and then today there was a report issued that he's been undergoing treatment of radiology and this new immunotherapy drug. It's called pembrolizumab. It's one of those weird names I can't pronounce. The brand name's Keytruda.
Mm-hmm.
At any rate, it enhances the immune system and directs it into the cancer better than previously.
Mm-hmm.
To me, it all sounds too good to be true, or they're finally releasing some of the miracle drugs that they probably been hiding from the general population for a long time.
Mm-hmm.
But I find it very interesting. I agree with you totally. You said before that we have cancer throughout our lives, and our immune system is constantly taking care of it as long as we maintain a healthy immune system.
Mm-hmm.
So I've always thought that this immunotherapy is the route to go with everything, if possible. And I understand that it can get to the point where it attacks healthy organs, so it's got to be directed. But I was just wondering your thoughts on that subject.
You bet. I think this type of immunotherapy, melanoma, is one of those cancers that probably responds extremely well to immunotherapy because of first of all, the type of cancer it is, the rapidly dividing type of cancer, and because of the proteins and the other things that can actually be picked up on the actual tissue. I had heard of them actually taking melanocytes or different cancer cells and actually using some of the antigens that they actually will process that and actually develop an immune white blood cells or your own white blood cells to go in and try and attack, that particular type of cancer, and that may be a form of that. So, yes, there is absolutely no way you can really get a cure from cancer unless you're basically, stimulating your own immune response. And that's what I don't like about chemotherapy, is that it really is non-specific. It's really wiping out your good tissues as well as your bad tissue. And I think the belief is that there's been a conspiracy a long time not to let some of the newer medications and newer drugs out because cancer chemotherapy, and because of the way that they've done it, has been so ingrained in certain things. Now, I don't know enough about that to be able to say that. Certainly as the newer drugs come out and the FDA is limiting those, do they want us to live forever? I would think that there's really no harm in doing that. And this is a political statement, you know, they trashed our money supply so long that who can really afford to retire? So as long as you're out there earning a living and generating income, you're creating to the tax system. So I think they would like people to live long as you could work. But then again, our younger population and everybody else doesn't seem to really want to work today, so that's another issue, as long as they're giving away free stuff. But that's off the subject. I'm not a political commentator, but I do believe that, yes, the immune system is the key for everything in our system, and that the things that we do to ourselves that degrade our immune system, not getting enough rest, not eating the right foods, the things, getting a fair amount of exercise, not killing ourselves with exercise, not destroying our tissues, but helping the rejuvenation cycle. All those things have to be in homeostasis and in balance, and then we might live as long as we possibly can. And obviously age does take its toll on a lot of things, but these diseases like infections and cancer and other things of that nature, certain degenerative diseases, things of that nature can be helpful. Antioxidants can be very useful. There is one of the things, and I don't have it on here, but we're going to go to break in a few minutes, but it is, there is a YouTube video of a gentleman receiving a large dose of a antioxidant, and he has severe Parkinson's, and I think he's a veteran in the picture. And Dr. Perlmutter gives him an injection of this rapidly resolving antioxidant, and the man can barely walk, can barely talk, and they actually show him going up and down the hallway, almost like he's cured from his Parkinson's disease. So that brings up the subject of, you know, antioxidants and vitamins and things of that nature, and that whole host. So too much of any good thing is not good enough. Is too much of anything is not good. The right balance is the key, and hopefully those therapies will become more available in the immunologic realm. So we're going to go to break, and when we come back, hope we get some more callers. Thank you very much, Chuck, for calling in.